Hello, this is the second part of the presentation, stroke. I do recommend that you watch the first part before you see this one. We now know that stroke is actually a brain attack and not heart attack. In the first part of this presentation, we've learned about the warning signs of an impending stroke, facial distortion or loss of vision, arm or leg weakness or complete paralysis, speech problems, inability to speak or understand, and sudden very severe headache. And also we learned that it is extremely important to know the time of onset of these symptoms. We saw this image depicting the warning signs of a stroke. Now, why is the time of onset of symptoms so very important? Because the effects of stroke can be reversed, and this is what I want you to keep in mind. The effects of stroke can be reversed when the diagnosis is made within the first few hours and the treatment is started promptly. The most important first step once the patient reaches the hospital will be to determine the cause of stroke. Is it an ischemic stroke, meaning is it due to a clot in the blood vessel, or is it a hemorrhagic stroke, meaning is it due to bleeding into the brain? Now we've learned about these two types of strokes in the first part of this presentation. Brain CT or MRI is necessary for diagnosis. Now there is a specific medicine called alteplase, which can break and dissolve the clot and restore the blood flow. But this is the caveat: it has to be given within the first 4.5 hours after a stroke. Actually, within the first 3 hours is ideal. If it's given beyond this time, there will not be any effect. And this medicine can only be given for ischemic strokes. So the first step once the patient is in the hospital is to determine if the stroke is due to a blood clot or a bleeding or ruptured blood vessel. If the stroke is due to a blood clot, then, and if the symptoms have started less than 3 hours or up to 4.5 hours before the patient presented to the hospital, then this medicine called alteplase will be given. So we just learned why it is so important to reach the hospital in time. Again, this medicine called alteplase is given intravenously for stroke caused by blood clot. Now keep in mind that in certain situations this medicine cannot be given, and the physician who's evaluating the patient will make that determination based upon various factors. And also the cost of this medicine is about 80,000 rupees. Now if the blood flow to the damaged portion of the brain is restored fast, the chances of paralysis or other permanent disability will be reduced dramatically. That is the reason why it is so important to reach the hospital in time if you or your loved one is having any warning signs of an impending stroke. And the immediate steps, keep this in mind. If you think you or a family member is having a stroke, call your local area ambulance service. 108 works across many parts of the country. If for some reason you are unable to access ambulance service, you will need to rush to the emergency department of the nearest well-equipped hospital immediately. Again, timely treatment is of utmost importance. It can save your or your loved one's life. I'd like for you to understand the significance of this, and please spread the message to everyone you know. I'd like to introduce another term here called a mini stroke or TIA. TIA is transient ischemic attack. The risk factors for TIA are the same as for a stroke, and we will go over them in detail in a few minutes. TIA causes the exact same symptoms as a stroke with some key differences. The main differences are that the symptoms caused by a TIA last from a few minutes to a few hours and then resolve. And TIA is caused by temporary blockage by a clot in one of the blood vessels in the brain tissue, and since the blockage is temporary, the there is no permanent brain damage. For many, a TIA is a warning sign before a full-fledged stroke. And also, if a person has had one or more TIAs, that indicates that he or she is at a very high risk for having stroke in the future. Is it possible to prevent stroke or a mini stroke? Absolutely yes. If you take care of your risk factors, you can prevent stroke. And what are the risk factors? We've gone over these many times before, and the list remains the same. High blood pressure, high cholesterol, diabetes if they are uncontrolled, being overweight, smoking or using smokeless tobacco such as gutka or pan masala with tobacco, etc., excess alcohol consumption, very limited or no exercise activity, sedentary lifestyle, and heart disease. Now you can see that all the factors except for heart disease are risk factors for heart disease also. So these risk factors that we've just elaborated, if they are present, if one or more of them are present, the chance for having a stroke goes up. I hope you will agree with me when I say prevention is always better than cure. Eat healthy, eat home cooked food as much as possible. Stay active throughout the day. Just be active doing whatever you do normally in your daily routine. Walk, stand, move around, climb stairs. Just stay active. In addition, if you can incorporate 30 to 45 minutes of physical activity, such as brisk walking, that will be wonderful. Do not smoke or use tobacco in any form. Smokers, quit smoking. And for all those gutka, pan masala with tobacco and other forms of tobacco users, this kind of tobacco is equally dangerous, and you absolutely will have to stop using it immediately. Quit drinking alcohol. Make sure that you get your blood pressure, your blood sugar, your lipid profile checked on a regular basis. And I have elaborated these issues in more detail in the presentation Know Your Numbers, which is also on this YouTube channel. If you have high cholesterol, high BP, and or diabetes, make sure that they are under good control. And if you are overweight, try and lose weight. Remember that losing even 10% of your current body weight is going to be extremely beneficial for you. If you have heart disease, make sure that you take all the medicines as prescribed by your physician. By controlling your risk factors, you can avoid stroke. Thanks for watching.